क्या सोरियासिस की वजह से आप सोशल एक्टिविटीज़ को अवॉइड करने लगे, जिसकी वजह से आप लोनलीनेस एंड आइसोलेशन एक्सपीरियंस करने लगे हैं? ऐसी फीलिंग आने लगी है दैट यू आर अनअट्रैक्टिव? सोरियासिस आपकी रिलेशनशिप्स को घर पे, स्कूल्स में और वर्क प्लेस पर इफ़ेक्ट कर रही है और जिसकी वजह से आप फ्रस्ट्रेटेड रहने लगे हैं। दिस इज़ बिकॉज पेशेंट्स आर फ्रीक्वेंटली स्टिग्मेटाइज्ड and excluded from social environments, including schools, workplace, and swimming pools. People think that it is a contagious disease. और ऐसा इसलिए होता है because लोग aware नहीं हैं about psoriasis. Hi, I am Dr. Priya, a homeopathic physician, and today we will be talking about psoriasis, its causes, its types, its impact on health and quality of life, diagnosis of psoriasis, how we can manage psoriasis, and what homeopathy offers in cases of psoriasis. So let's begin. The word psoriasis comes from an ancient Greek word, psora, meaning an itch or itching. The suffix iasis added to it denotes a condition. So psoriasis means an itching condition. 4% of people worldwide are affected by psoriasis. It is categorized as a non-communicable disease. It seems to be contagious, but it is not. ये एक दूसरे के टच से नहीं फैलती, जिसकी वजह से एक सोशल स्टिग्मा क्रिएट हो गया है. So we should keep in mind that it is a non-communicable disease. Psoriasis is genetically determined immune-mediated inflammatory disease. Psoriasis involves skin, nails, and is associated with a number of comorbidities, with a prevalence of 0.44% to 2.8% in India. It commonly involves individuals in their third and fourth decade of life, with males being affected 2 times more commonly than females. But some studies also says that it has 2 peaks of incidence. One is between 15 to 25 years and other is between 50 to 60 years of age. So अगर हम broadly देखें, so it can affect individual at any age. So let's now discuss about the skin lesions of psoriasis. Psoriasis lesions can be generalized, that means पूरी body पर हो सकते हैं, or localized to certain parts. They are mostly symmetrical. The margins are sharply demarcated. They appear as red papules and plaques. And the lesions are usually covered with white or silvery flakes, which is characteristic of psoriasis. Psoriasis के lesions में itching, burning और stinging sensation हो सकती है. Individuals with psoriasis may develop chronic inflammatory arthritis, जिसको हम psoriatic arthritis भी बोलते हैं, that leads to joint deformities and disability. Certain studies show that individuals with psoriasis are reported to be at increased risk of developing other serious clinical conditions, such as cardiovascular disease, obesity, low self-esteem, and even depression. So now let's discuss about etiology of psoriasis, or we can say exciting or triggering factors for psoriasis. So exact cause of psoriasis remains unclear, although there are certain evidences of genetic predisposition. It can also be provoked by external and internal triggers, including mild trauma, जिसको हम कॉबनर्स फिनोमिना भी बोलते हैं. इसमें क्या होता है कि अगर किसी इंडिविजुअल को कहीं पर चोट लगती है तो वहाँ पर सोरियाटिक पैचेस अपीयर होने लगते हैं. इट कैन ऑल्सो बी ट्रिगर्ड बाय सनबर्न, सर्टेन इन्फेक्शंस लाइक स्ट्रेप्टोकोकस इन्फेक्शन, HIV. इट कैन बी ट्रिगर्ड बाय स्ट्रेस, स्मोकिंग, alcohol consumption, and by certain drugs like beta blockers, lithium containing drugs, anti-malarial drugs, non-steroidal anti-inflammatory drugs, ACE inhibitors, and antibiotics. Now let's understand the structure of skin. Skin has basically three layers: epidermis, dermis, and hypodermis. Epidermis is further divided into stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. Epidermis is made up of developing keratinocytes. Stratum basale, which is known as stem cells of epidermis, continuously divides and forms new keratinocytes. New keratinocytes push up old dead cells, forming skin flakes and dandruff. In this way, the thickness of epithelium remains constant due to regulated turnover of keratinocytes. In the dermis, inflammation causes the blood vessels to dilate. That allows more neutrophils to enter the epidermis. Neutrophils accumulate in stratum corneum layer. Inflammation leads to proliferation of keratinocytes excessively and mature abnormally. Increased keratinocyte production thins out stratum basale but thickens stratum corneum and stratum spinosum. Proliferating keratinocytes have few maturation defects. In stratum corneum, they produce more keratin and are thicker. They retain nuclei, which is known as parakeratosis. They do not adhere properly, which leads to scaly appearance. And if the scales are picked off, the blood vessels in the dermis gets injured, causing localized spots of bleeding known as Ospid sign. So now let's talk about most frequent symptoms of psoriasis. According to Global Report on Psoriasis by WHO, scaling of skin, itching, erythema, which means redness, fatigue, swelling, burning, and bleeding. Now let's talk about diagnosis of psoriasis. So diagnosis of psoriasis is clinical. It is diagnosed by history and clinical examination. जैसे कि हमने बात की, it has typical skin lesions that are characteristic of psoriasis. A skin biopsy may be needed to exclude other skin conditions. Psoriasis can be categorized as mild, moderate, and severe according to Psoriasis Area and Severity Index score, PASI score, which is basically used in cases of research. So ये score basically 3 parameters पर assess करता है psoriasis को: redness, thickening and scaling. So अब हम बात करते हैं psoriasis के types के बारे में. Psoriasis vulgaris. It is most common type of psoriasis. इसके skin eruptions or lesions are red, sharply demarcated, raised, dry and covered with white or silvery scales. It involves scalp and area behind the ears, the extensor surface of the body, forearms and shin, trunk, face, and even on palms and soles. Another type is intertriginous psoriasis or inverse psoriasis. It affects the flexural body sites. Basically, it affects folds of body, axilla, antecubital fossa, inframammary creases, popliteal fossa, umbilicus, groins, genital area, gluteal cleft. The eruptions are wet or moist due to their location. The eruptions are deep red or white and scales are not present. Another type is guttate psoriasis, which is also known as droplet psoriasis. It is most common in childhood and adolescence. It mostly occurs after streptococcal infection of upper respiratory tract. The eruptions are reddish, drop-like papules or plaques, mainly on trunk, arms and legs. Another type is pustular psoriasis. There are sterile pustules, or the pustules are filled with non-infectious pus. It involves either small areas like palms of hands, fingertips, nails and soles of feet, or the entire body surface. It can occur as a single episode after a trigger. Another type is erythrodermic psoriasis. So here the eruptions are fiery red and exfoliation of most of the body surface. It is the most serious type of psoriasis, potentially life-threatening because it can lead to hypothermia, and hypoalbuminemia. Another type is psoriatic arthritis. About 5 to 10% of patients with psoriasis have associated joint complaints और ये most commonly उन individuals में देखने को मिलती है जिनमें nail involvement होता है. It can be seen as punctate pitting, nail thickening or subungual hyperkeratosis. Now comes the treatment part. So according to WHO, it is based on controlling the symptoms as there is no cure for psoriasis. So topical and systemic therapies along with phototherapies are available. We should keep in mind that psoriasis is a chronic disease that evolves in the form of recurrent inflammatory flare-ups followed by periods of partial or complete remission, which means ये एक ऐसी condition है जिसमें flare-ups हमें काफ़ी देखने को मिलते हैं, either partially और complete. हमें ऐसा लगेगा कि डिसीज ठीक हो गई है बट ये कुछ टाइम बाद वापस से लौट के आ सकती है आफ्टर सर्टेन ट्रिगरिंग फैक्टर्स. सो हमें ये हमेशा ध्यान में रखना चाहिए. बट एज अ होम्योपैथिक फिजिशियन आई विल बी टेलिंग व्हाट होम्योपैथी ऑफर्स इन केसेस ऑफ सोरियासिस. होम्योपैथी ट्रीट्स ऑन द बेसिस ऑफ इंडिविजुअलाइजेशन. It treats the person who is having the disease, not just the disease. It works on the root cause of illness, the maintaining causes behind it, and many other factors. Now let's talk about homeopathic medicines for psoriasis. These are the medicines present under rubric psoriasis given in Kent's repertory. Rubrics for psoriasis on different locations are also present, like psoriasis of eyebrows, psoriasis of soles, psoriasis of knees, etc. And these are the medicines given under rubric psoriasis in Borik's repertory. The medicines are again selected on the basis of individualization. So management of psoriasis also includes screening at regular intervals for associated diseases such as metabolic syndromes and cardiovascular disorders, as well as depression, anxiety, and suicidal ideation. The patient should be encouraged for general weight management, smoking cessation, and decrease alcohol consumption. I have also shared a case of mine that was basically of drug-induced psoriasis, managed effectively by homeopathy along with certain lifestyle modifications. So you can check it. I am putting the link. Don't forget to subscribe the channel and hit the bell icon for upcoming informative videos.